Water is an important resource that no one should take for granted. On the Siksika First Nation in southern Alberta, two distinct but equally vital monitoring systems work to protect public health. Water monitoring looks at our drinking water sources, ensuring they remain safe for consumption and free from harmful contaminants before reaching our taps. Wastewater monitoring, on the other hand, analyzes what we flush away, providing important early warnings about the community health risks and environmental impacts after we've used this precious resource. Together, these monitoring systems form a complete picture of water's journey through our community. This is the story of how we track, protect, and learn from every drop.
So water safety is a team effort between Siksika Nation Health, Public Works, and myself. At Siksika Health, we have the CBWMs who conduct the sampling with assistance from the CHRs when necessary. They're really the boots on the ground. The water treatment plant operators are active at the plants on a daily basis, ensuring that the water is treated, and as well myself, who does all the reporting and the analysis of all the information that is provided by the sampling.
My actual role is a CHR, a community health rep. I've been here since 2005, and I help out the community-based water monitor that was hired about 10 years ago. Her name's Vanessa Redgun, and she does the main water. I'm just more of a support if she's sick or if she just needs that extra help. And it seems like on a weekly basis I'm helping either the west or the east. But we've been doing sampling since the early 80s. It was the CHRs that first started the water sampling back then. We have a public system and a private wells that we sample.
I believe this wastewater testing is kind of, it is, I find it's a new recent thing within Siksika, but I see it being very important in other stuff that we can detect into the water, like something might be going on in the public water system that we don't know, and then from that wastewater being tested, it'll give us other stuff, just like my bacterial test for E. coli and total coliforms. The wastewater testing would be integral in capturing other things going on that we don't normally see or test for, that I don't test for, but I think it's very integral to continue in that work.
Learning system. You learn something new every other day, and it's part of environment. You know, youth that are getting into schooling for environment is great because it looks after everything: the water, air, all your surroundings, their environment. And water is one of the main. Is actually the main. Water is life. So youth, that's a great opportunity for them to step in and be able to gradually move up within the environmental aspects of the for the nation itself.
Well, I think at Siksika Health, we're always trying to build community capacity, and we're always trying to expose our youth to the health fields, whether that be, advocacy for nursing or paramedicine, but also all of the other areas like water monitoring that play such a crucial role in keeping the community safe and the public safe. And sometimes I think that we take for granted clean drinking water. We're very fortunate in our rural communities that we're able to have that, because we know that some rural communities, maybe in the north, don't have that. And so we always want to teach our youth about how important it is and how our everyday lives can be impacted by something like not having clean drinking water so quickly. So we love to expose, we have often summer students within community health that either work with our various teams, so we like to expose them to opportunities to go out with our staff and learn about it and encourage them. I know that our EHO, Ryan Boyd, is a huge advocate of always trying to convince people to follow him and look at some of his role, because it's a very important role, the environmental health officer. And so we always try to, again, invite people to come and learn about what we do here and why we do it, and what are the opportunities, what are the job opportunities. And then we get also a chance to talk to them and encourage them about, you don't need physics and you don't need certain levels, to go into certain areas of health and make a huge impact for your community. So just encouraging youth to be curious and to be able to provide opportunity to share information with them.